Good morning. Today we're going to be talking about annual health checks, what to look for, especially in annual health checks. We do them a lot, at least we hopefully do them a lot. But the questions we need to answer are why, what are we looking for, what do we gain from it, so we can make the most of this very, very important subject. Thank you, Dr. Olorode and Dr. John, for coming on the program with us. It's a pleasure to have you both with us.
Thank you very much, Dr. Pamela. Thank you for having me.
If I can start with you, Dr. Olorode, and just ask you, can you explain what an annual health check is and why it's important and who it's important for?
So thank you very much. It's a very good question. One of the major things that is behind annual physical checkups, at least once a year after you get over the age of 30, 40, is that there's some diseases that when you catch it earlier on the onset of the disease, it's easier to manage and it leads to less side effects and less people dying. So it's very important for you to have annual checkup. And we usually recommend it that if you're over the age of 40, you have it at least once a year. What do you actually look for when you go for your annual checkup? The very first thing the doctor does is to have some discussion with you to check some of your family history, because there's some diseases that they have some hereditary in nature. And therefore, it makes sense to look out for such diseases, things like breast cancer. Some breast cancer, some colon cancer has some genetic predisposition. So the first of all, when you go for your annual check, the doctor will have a dialogue with you just to check your family history, if there's anything that runs in the family for them to look out for. Then after that, they'll do some physical examination, such as the breast examination, listen to your chest, take your blood pressure. Your blood pressure is very, very important because hypertension is what we call one of the silent killers. Usually people don't have symptoms. When I mean symptoms, they don't have anything warning them that they have a high blood pressure, so it can be quite late. So it's important that they check your blood pressure to make sure that you don't have hypertension. It's also important for them to check your urine and also a fasting blood sugar to ensure that there's no high sugar level, you're not diabetic, so that this can be managed. So after they've had the physical examination, there are a couple of tests they must do. I'll start with the women. There's some common cancers in women that it's important for us to screen for. One of it is the breast cancer. It's one of the major cancers that kills women if it's not detected early enough and it's not taken care of. So one of the major things we do is that after the age of 40, they recommend you have a regular mammogram. A mammogram it's an X-ray that looks at the breast tissues to see if there's any mass. But even you as a woman, it's important that you have a monthly, you check you do regular breast examination to ensure that there's no unusual discharge, there's no unusual mass in your breast. The other common cancer that we look at for women is what we call the cervical cancer. So it's important, especially for sexually active women, if you're in a relationship, to check what we call a pap smear. So they do a little swab of your cervix, and they take it for some histology to look at the cells to make sure they're not abnormal. If those things are caught early enough, they can easily be managed, and you can have very good outcomes from it. For men, one of the major common cancers in men is the prostate cancer. So usually, when you go for an examination as a man, it's important, we call it a rectal examination to ensure to feel whether the prostate is enlarged. And also, it's something you do what we call a PSA, a prostatic specific antigen test. It's a blood test. And it's important that that is done to see if it's elevated. If this is elevated, you might need to do a biopsy to see if there's any malignant cells in it. There's some important bloods we must do. And those are things like a fasting blood glucose, a fasting lipids to make sure that you don't have high cholesterol, so that is easily managed. It's also important to have your full blood count to see if there's any form of anemia or if there's any other underlying red cell malignancies And the other thing also that is also needs to, it's about to check is also to check our urea and electrolytes to ensure that our kidney function test, our kidney is functioning very well. So in a nutshell, what we're trying to preach is that if you have this annual checkup, the doctor will be able to see if you have a clean bill of health. And if it's a clean bill of health, that's good news. But also if there's any diseases brewing, when I mean brewing, that in the infancy stages, it's also good news because these are the stages that medical intervention can work successfully to have a very good outcome. Thank you.
Thank you. Thank you. Thank you. Thank you. That's so important. So, I mean, you've actually answered a number of my questions already, which were things like what are key tests for screening and so on. But I want to ask at this point, because you've talked a lot about the different kinds of tests, those are for women and men. But are there any particular people who should prioritize annual health checks above others? And at what age should they start?
So first of all, I mentioned some cancers, and
Mhm.
breast cancer or cervical cancer. And breast cancer, cervical cancer, and colonic cancer. So if you have a family history, that if your mother in the time past or you had a sister that had breast cancer in the past, it's important that you really do have a regular check of your breast and you have a mammogram because some of these cancers run in the family. So it's also important. Also, hypertension, diabetes are things that run in families. Also, there's only genetic predisposition, but you find that some of this disease runs in family. So if you have a family history of hypertension, if you have a family history of diabetes, if you have a family history of breast cancer, cervical cancer, these are things you need to check early yourselves.
Interesting. And you've talked also about results coming back abnormal. What should a person's next steps be?
Look, most places, when you have your annual physical checkup and the doctor that reviews you will review your results with you. And so when they review the results, if all your results are normal, they still have a discussion, which we call it counseling, to ensure that you maintain a healthy lifestyle and what you should look out for in future also. If any of the tests are abnormal, what they normally do to you, they just have discussions and discuss with the different options you have available for you. The options is that, first of all, they might need to do further investigation to see if there's any spread in the body, and they will tell you the different treatments. You might need some of it is just simple surgery. I think some early stage of cervical cancer is just a simple crochet. So they'll now have a treatment plan with you. They'll discuss with you, they discuss options, and between you and the doctor, you make a joint decision plan, the next steps to take. And usually, if
Okay.
the steps are taken, it usually aborts the disease at an early stage.
Well, thank you. I think that's very important that we look at all of these things. Now, you are the proprietor of Diamed, and Diamed is a very highly sophisticated hospital with a lot of sophisticated equipment. Now, can you tell us who needs to do sophisticated, very advanced testing or screening, and who can just do the basic ones?
So for me, I don't know what you mean by sophisticated because the tests are usually also it's blood pressure. Everybody should have their blood pressure measured. I mean, those are the simple tests. You don't need to even go to hospital. You should monitor your blood pressure on a regular basis. Um, Especially as you grow older, you have more, you're not exercising that much, you're putting on weight, a sedentary lifestyle. It's important you have your blood checked on a regular basis. The other thing that those are not sophistication. The other thing I also mentioned is that you need to regularly have a self-examination of your breast. Um,
You mentioned that already.
and the other thing I forgot to mention is it's important you have your ECG done regularly also. So that shows you the heart tracing and the chest X-ray. Because if you have silently your blood pressure has been elevated for a long time, If you have a chest X-ray, we call what we call it cardiomegaly. That means you can have enlarged heart that can show up in the X-ray and can help your cardiologist to manage it better. But things like the chest X-ray also are all simple tests. The mammogram are all simple tests. It's only when you have detected maybe you have a breast lump and you're not too sure of what is how to manage it. Then you can have more sophisticated tests like MRI. MRI gives a better dimension of the lump or the mass that is detected, and also can give you if there's any spread. So that's when you go into the more sophisticated state. But things like X-rays are simple tests that people can have done. So as you progress, if there's a detection of something from the simple test, you need to have the advanced test, so you can have proper diagnosis, so you can better manage the disease.
Thank you. Thank you very much. Thank you, Dr. John, for coming on the program. It's a pleasure to have you with us. Now, talking about the Medbury group, I know you do occupational health, and as part of occupational health, you recommend corporate health screenings. For those people who are listening who may be corporate organizations, can you explain why it's important for corporates to undergo health screenings for their employees?
Yeah, absolutely. Thank you very much for having me again. And thank you, Dr. Abiola Olorode, because you have really covered very, 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 very extensively the subject today. The first thing I'd like to say is that in occupational health, we are reinventing the terminology annual health checks, because if you check the word annual, it means it's a yearly check. What that supposes is that you have to check every year. But just like Dr. Olorode said, there are people who need to check even more frequently, and there are people who need to check more at a longer distance based on their age and their risk factors. So we're using the word periodic medical checkups, and that helps to put it in good perspective, a better perspective, and get the buy-in of the clients, because they are not patients yet. They are not sick yet. So I like occupational health because you are managing well patients, and that's the part of that I like the most. So the first thing is that you have to get your participation, like she mentioned. So I said that to say this. A lot of occupational health screenings related also to annual health checks. So, for instance, if you go to OG UK, they want to know if the employee is well, and they're also doing liver function tests, and they're also doing lung function tests, because they have to be fit to go on. But the practice is that they then combine both. So instead of subjecting the employee to jabs more than once a year, they then combine sometimes to say screen them for fitness and also for annual for the wellness aspect of things. So we then see the opportunity to also, and secondly, you notice that from the data that we have seen everywhere, National Bureau of Statistics, the largest number of people who are healthy, have good health seeking behavior, are the people who are in the organized sector. And so the acceptance and the uptake is higher there, even though it's important for everyone. So having said that, the importance of annual health check for employees is, number one, because the risk factors may be or usually higher than in them, because they are exposed to more risk factors, chemicals, work conditions, stressful work conditions that can increase their risk. So even if they have very low family history or no family history, you find out that the risk increases as they work, as they continue on the job. They work in very dusty environments, very hot environments, where they're exposed to. So they need to do these checks more often. And that is why we take the opportunity to screen them. So what we do is that we will then assess the employee against the job he does, against the lifestyle he has, against the personality, just like Dr. Olorode said, the sort of examination and interviews that happen before this and helps us to advise appropriately. Sometimes you come to us and all you came to do is an assessment that will require just 2 investigations or 3. But based on the assessment we've done, we can advise you to take more, and even if not immediately, to take it more frequently. And so that's how it comes into corporates. I have already mentioned that the corporates usually use the opportunity to do the full screening of the employees. The other advantage is that it also helps them to check that they are continuously well. That's why it's periodic. So if you do a screening this year, you already know that because of this outcome, you need to do the screening in the next 6 months, not in 2 years. I've seen someone come into my office, and while I was consulting with him, only the family history of prostate cancer in the family changed or added or modified his investigations. And that's how it works. Now, having said that, the other approach to it is that because the employee has the opportunity to do a lot more things because they're in the organized sector and the employers are more interested and there's funding, which is a problem, then there is the opportunity to carry out a lot more investigations that are specific to what they do or to what risk they're exposed to. So generally, annual regular medical checkups or the routine checkups or the periodic checkups, like you will call it, corporates usually put a cutoff of 35 years for females and 40 years for males. You will see that practice more commonly. We think that that is motivated by budget, but because really some people need to check earlier because they have family history, just like Dr. Olorode said. Family history informs you that you have to do this earlier in a safe way, because you won't do a mammo if you're less than 40, for instance. But yes, you can do a breast scan. You can, of course, do your breast examinations and, of course, breast MRI, like you mentioned. So that is one thing that informs what that modifies their sort of annuals. And then you know that they also have the opportunity to get some done on site while they have to go to the centers to do some of the tests. One of the limiting factors is also the distance to where they are going to get this done. For instance, colonoscopy is if you come to cancer screening, I'm not going chronologically now because Dr. Olorode has
no problem. Please carry on.
Yeah, but I'm just doing this so that the audience understand the basis for which I'm advising. So, for instance, we go to colon cancer, for instance, prevention and screening. Colon cancer is common in the in people that are older than 50 years, but early detection is what we preach these days. The gold standard for diagnosing colorectal cancer is a colonoscopy, which is the examination where you insert the surgeon, a trained surgeon, or a health worker that is trained would insert that equipment into the anus of the client and examine physically to see there are polyps or bleeding or anything. These days, there are chemical tests that they call the FIT, fecal immuno chemical testing, and that is a a test that you it's not invasive. That's what I mean. It checks for bleeding in the colon. It checks for if there's bleeding in the colon. There's limitation to it because you will see that even though it's cheaper than the colonoscopy, it's cheaper. But there's limitation because what if the person is not bleeding at that time? So you have very high incidence of false negatives, let's put it that way, or even false positives. So it's not really foolproof that the person doesn't have a colorectal cancer. So the ideal thing is to do, but we have a limited coverage of colonoscopy. And so they will not be able to do it if they don't have a center close to them. But the corporates are able to give that opportunity to the staff to do it. So you see that compliance is higher in employees because they have arrangements to do it with the hospitals and, because they will be paid for. But for those who are going to pay themselves, there's this limitation. So I think the education is, now that you know, you can then ask for it for yourself and not think of the cost, because if you think of the cost of treating cancer, then you will also, know that it's better to prevent, because the prevention is cheaper.
Much better than cure.
Yes. So that's some of the practices in the corporate. I think one other important thing to mention is education and awareness creation. And I think that's also easier, more organized in the corporate sector. So for instance, for us, we have every other Saturday, we educate employees and we have platforms where we have about 90 to 100 people attending every time, and they're educated. But, I'm not sure how many people would only radio lovers will listen to this. I believe that that is something that they have to go the extra mile to do. But in an organized setting, it's easier. Now, I'm just saying that's more organized, but we have to
Well,
keep pushing.
actually, we actually have, I must tell you, we have millions of people who during drive time listen to the radio. So this actually goes further. But
Fantastic.
we need to, yes. So this is important, but unfortunately, you won't believe this. A time is already up. And we actually
Right.
don't have any more time left on this program, which is a real shame because there was a lot I wanted to ask you, particularly the issues to do and related to some issues to do with stigma and some issues to do with people being afraid of taking tests in a corporate organization and being stigmatized. So there are some of those things that I had wanted to address with you, which we can't do now, but perhaps we can do later. But just to wrap up, can I ask Dr. Olorode, do you have any last words for our listeners?
I think, Dr. Pamela, you touched on it. A lot of people are afraid to do tests. They feel that what they don't know doesn't harm them. And the other misconception is that I look good, I'm healthy, why should I do a test? But what I should tell people is that it's better to do the test and to get the information and to manage it appropriately. And that's what medical science is for. And there's no need to be afraid. Even things that we thought were killers now can be managed effectively and people can live a very good, fulfilled lifestyle. Those are the final words.
Thank you. Dr. John, your last words, please.
I think it's appropriate to touch on that now that I have the opportunity. Yes, I'm aware that the stigma is an issue, even in the corporate sector. We find settings where even the mental health platforms that are created, people don't want their names to be mentioned, but they want the service. So I think that the way to do it is to be creative about passing providing the service. We do anonymous service platforms. People take different identities. But at the same time, they also need to know that what is worth doing is worth doing well. So you will have to take the bold step to get it done. But I think it's about information, education, and continue to educate people and be creative. And I like to say that I like to move 1-2 steps ahead, just in case this doesn't work for the client because of stigma. I find another platform where they can access the care or access this service by doing telemedicine services where they do not have to show up, or we even allow them to join groups that we sponsor that are not even known by the company. And those are creative ways that we do things that have to do with stigma and all that. There are many things around HIV treatment and testing that there are policies that can help to push that forward by having anonymity in the policies, such that people do not have to show their names or show anything that will make them feel. But at the end of the day, it's still about the patient or the client. Thank you very much.
Thank you. Thank you very much.
Thank you for watching. Please like, share, and subscribe for new video updates.